So we're looking at the concept of puerperal sepsis. Alright, puerperal sepsis. Okay. So I've looked at maternal sepsis, which is mainly affecting women that are with pregnancy, mostly, Then puerperal sepsis, this one is what? Postpartum. This is after the woman has given birth, postpartum sepsis. So it's a potentially life-threatening infection of the female, reproductive tract. Occurs after childbirth, or maybe there's miscarriage or abortion. So it's a major contributor to what? Women dying, or women suffering from a lot of sickness after childbirth. So what could actually cause this sepsis? Of course, sepsis is when you have an infection, and the infection is basically going to your bloodstream, to cause all those fevers, spread to other parts of the body. So things that could cause puerperal sepsis include things like what? Group A Streptococcus, Escherichia coli, Staphylococcus aureus, anaerobic bacteria are the Clostridium species. So these organisms, they can invade you through what? Unsterile instruments or hands, prolonged labor or rupture of membranes, retain placental tissues. Maybe there was Cesarean sections and one or two surgical procedures that predisposed you to, wounds, and the wounds were not taken care of, so you had what? A spread of infection. So, risk factors. What will make you more likely to have this puerperal sepsis? If your labor was so long, has Cesarean delivery, retained placenta, poor hygiene during delivery, multiple vaginal examinations. Of course, if they are examining your vagina, they are putting hands in it, So, if the healthcare provider doesn't have good health or hygiene, they can push infections to it. So pre-existing conditions like diabetes or anemia, right? So symptoms is the person is having fever, so body temperatures are more than 38 degrees Celsius, chills and rigors, low abdominal or pelvic pain, foul smelling vaginal discharge, rapid heart rate, you are weak, you are feeling like you are unwell, uterine tenderness, and sub-involution. Diagnosis is what? Physical examination and history. You're just trying to ask some one or two questions to know the root of the problem. Blood cultures and what? Complete blood count, uterine and vaginal swabs. Imaging, this is where you want to now view the inside to see if there's any structural damage to the organ. So treatments, if you are dealing with infections, use antibiotics. Alright. Surgical intervention is if any tissue is retained or there's any pus retained anywhere. Supportive care like fluids, oxygen, pain relief. Then always monitor for any complications that may come up.